One of the biggest myths of rheumatoid arthritis is that it only affects old people. And so I might have a woman in my office who's 35 years old and she says, I can't have rheumatoid arthritis, I'm not old. The fact of the matter is, even children have rheumatoid arthritis. So rheumatoid arthritis is a disease that can affect you any time of your life. Another myth of rheumatoid arthritis is that your child is going to get it if you have it. That worries a lot of mothers. If you have identical twins and one child has rheumatoid arthritis, the other child's chance of rheumatoid arthritis is just 1 in 4. But in the general population, it's 1 in 100. So even though a mother would pass on, if she had rheumatoid arthritis, pass on some chance of having rheumatoid arthritis to a child, it's not 100%. Another myth about rheumatoid arthritis is that it's only going to last for a certain period of time. That'll be like pneumonia or a cold. Really, rheumatoid arthritis is a condition that once you're diagnosed, it's one that you really have to manage the rest of your life. People do sometimes go into remission. Sometimes it's a spontaneous remission. Sometimes it's a clinical remission, which means that the medicine works so well that they're able to do anything they want to. I have a patient with rheumatoid arthritis on a chemotherapy who actually runs marathons, but he's the exception, not the rule. But really, anybody with rheumatoid arthritis needs to understand it's a disease that we don't have a cure for, and so it's something that you have to accept that you're probably going to have to manage for the rest of your life. Another myth of rheumatoid arthritis is that it can be treated well with alternative therapies. I like to think of them as complementary therapies. So for instance, I have a number of patients who use magnets. I have patients who use sometimes radioactive stones. I have patients who use crystals. There are probably some diets that help with inflammation in some patients, but diet alone is not a good treatment for rheumatoid arthritis because it's a systemic inflammatory autoimmune condition. It's your immune system that is attacking you. Diet may be helpful, but I wouldn't rely only on diet. I never tell them that it doesn't work because to them it does work, but I usually ask them to be on something that I know has clinical proof that it has worked in other patients. Really, the best thing for any patient is what works for them, and that's really determined more by the patient than necessarily a clinical trial, because it can be the greatest drug in the world, but if it doesn't lower your inflammation, then it's not for you. The bottom line with the myths of rheumatoid arthritis is you should never just accept arthritis. There's always something you can do for it, and particularly rheumatoid arthritis, because rheumatoid arthritis is a potentially deadly disease, and certainly it can be deforming and disabling. You really want to start with proven science. You want to start with a rheumatologist and work out from there. So start with the knowledge base of somebody who really is an expert in treating rheumatoid arthritis and add on and find what works for you.